Now, for midface and lower third, one new thing that we've been teaching is actually to come bevel down. So the bevel down will actually create a plane, a nice glide plane subdermally, while we're trying to catch a little bit of the deeper subcutaneous fat in this area. And in fact, you get fairly close to the SMAS, which is that investing layer of fascia around all of our facial musculature. So we'll position our patient here, and we're going to be coming around this cheek convexity, so it's important to kind of work with that convexity. So here again, we're bevel down. We are going in at a 30 to 45 degree angle, and as soon as we get through, we're going to drop the cannula and come forward here in a very flat plane. And you will need to show, because people will get caught here, you have some ligamentous attachments here, so you will need to show to countertract and put a little bit of force to come through this area. Now, coming around the cheek here, we're going to pull the cheek back and then end right at the where our dot is, which is right just kind of the medial aspect of the nasolabial fold. And what I do is I kind of push it into this area, hold it, and then twist, twist, twist back, just like we did with the brow. Twist, twist, twist back, and then massage to engage. Okay. And then we'll kind of pull and see that our entire midface, and actually we did get a nice kind of elevation of the midface just with that one. Now what I also do is to check for any superficial irregularities or puckers or problems. We'll have your patients smile, so go ahead and smile, and we don't see any puckers or irregularities, so that's a perfectly placed thread. If you do see a pucker or irregularity, you will actually pull back on the thread, push down with your thumbnail or pickups to lose some progress here. You'll actually feel it unclick, and then with your thumb kind of unzip the thread from its superficial aspect. So we're going to leave this thread in, and now we're going to do the second vector for the midface. So we're going to enter, and usually in the class we're going to be having the students do these. I will usually demonstrate one, and then I'll have them do the others because they're only getting a couple of areas here. So notice the counter traction, and then just kind of coming forward, and then ending right at our vector point. Now here we see we might be a little superficial, but with our bevel being down, the chance of this catching or causing a pucker irregularity is quite low now. So now the same technique of twisting, pulling back, twisting, pulling back. And this twisting motion really captures the threads kind of 360 degrees. Okay. Smile. Good. So we don't see any puckers or irregularities. Now, if in your class you start to see some of the lines wearing off, you will need to redraw those for your students because they're not really sure where to go.